we've heard about promoting muscles that goes across the knee joint and goes across the hip joint. And I actually would like to ask you, Dr. Hunt, and you have something to say, and you can say that, but I would like to ask you to comment on also, what are the qualities of muscle function that are important and that you think we should measure? And are we actually measuring the right aspects of muscle function?
Yeah, and thanks, Eva. So I just wanted to quickly just respond to your previous question, and I think it goes back to what Arna was saying earlier. And your question was, what muscles do we target? And I would argue, and maybe rather simplistically, we target what's weak. And if, there's been a number of studies that have shown that hip abduction and adduction strengthening works. And there's a number of studies that show knee flexors and knee extensor strengthening works. What they haven't really shown, though, is, are the people that are going into that, do they actually need it? Are they actually presenting at baseline with weak hip abductors or weak quadriceps and whatnot? And so I think Arna was right, where it would be great if we could go in and say, here's the bevy of potential opportunities. Let's measure your hip muscles. Let's measure your quads, your hamstrings. I would even argue measure your ankle plantar flexors. I don't think they get a lot of attention either. And really target the training to what is weak. And as we showed earlier, weakness is certainly more important than strengthness, for lack of a better term. And so, I think really it goes back to, what does the individual need? And so to your second question about, are we measuring the right things? Again, I think it comes back to what is important at that given time. Is radiological findings, are they important? And we all know that it's very difficult to find any real change with any treatment, exercise or strengthening included, in anything, say, less than 6 or 12 months. So are we looking? Certainly pain is important, certainly function is important. Dr. Messier had a really great paper recently where they looked at some of the muscle qualities, rather than simply looking at strength or looking at cross-sectional area, looking at things like fiber types. So I think there's a lot of things that we can measure that just really haven't received a lot of attention, and I think we'll be very surprised in terms of what we can find, just because we haven't looked in those areas yet.
Thank you. Dr. Messier, would you like to add to that? What aspects of muscle function do you think we should address in studies?
I can tell you from the patient's perspective, they like to have a whole body routine. I think just isolating one muscle group is going to get old really quickly. So even if that's not your focus, I would do an entire, at least lower body. We did upper body as well and core. And I think they like that. The older adults like that. But certainly we focus on the knee, right? But we do everything all the way up and down the body. Does that answer your question? I like what Michael talked about as well before about neuromuscular training. We're doing more and more of that now. I think that may be a better answer than just strength training by itself.
Thank you, Arna. I know that you're a big fan of both strength training and neuromuscular exercise. Would you like to comment on that?
Yes, we usually, as clinicians, we start out with neuromuscular exercises because we also have a feeling from the clinical point of view that they are much better tolerated in the beginning, and they get used to the different and learn the different exercises, and then we gradually progress into more high strength training, but progression over time. So yes, we usually do a lot of neuromuscular exercises. I think it's really important so the patients feel safe with the exercises. Those patients that you recognize that are fearful, they need to be confident in you. If you start out with high intensity exercises and they get a lot of pain, they won't adhere to those exercises. At least that's what I think also from a clinical point of view. So yes, neuromuscular exercises, that's a very good start, but make sure you progress the exercises. So I also think it's, as Michael said, that we also need to look into what the patients need based on their specific dysfunctions, but also what they like to do, what they adhere to, because if we are going to succeed with exercises, we need to make sure that the patients adhere to the exercises. And if the patients don't like the exercises, I don't think they will continue for 18 months. But
Ewa, can I make one more comment?
Absolutely.
So, we've looked over the years, a lot of years, more years than I'd like to admit, that we've looked at all types of exercises. And I mean, I'm getting to the point now where I'm thinking it doesn't really matter what you do, exercise-wise. You're going to get, as far as pain goes, you're going to get the same reduction in pain, which is somewhere between 20 and 30%. If you're lucky, you get a little bit more than 30. It doesn't really matter what type of exercise you do. You're going to get the same result.